This is a school-based health clinic task force, and the purpose is to talk about mental health and physical health of children. We all know there's plenty of research out there that substantiates that children who are not healthy do not come to school ready to learn, and there's a huge relationship between someone's physical and mental health and their readiness to learn and be successful in life. And so schools have had to turn around and look at those issues to ensure that we have high-achieving children. This task force is to look specifically at issues around how districts can support that. MSBA is here to facilitate the conversation. What we want to do is to be sure that districts have a voice, both from a top down as we look at regulations, statutes, policies, that are in place in our state, and what do other states do that allows them to address these issues so that we can learn from that and hopefully have those same opportunities for our children in Missouri. So MSBA is the facilitator. We're getting people together at the table. We're connecting agencies, we're connecting schools, we're connecting medical providers, trying to find the best possible solutions, not a best possible solution, but a number of opportunities for schools to design models to support the health needs of their children.
Today we're in Columbia, Missouri, to present on basically our health-based clinic that we have at our school called The Spot. And we are very student-focused, and so we don't even call it a clinic, we call it The Spot in Jennings. And we were here to share the incentives for students, the benefits for a school district, as well as the need for advocacy so that you can have funding and support and awareness for sustainability. And then also there's a need for some new innovation in the area of trauma-informed practices. Right. It's so essential to meet students where they are and to see what the needs are and to move at the speed of the need. Because when you move at the speed of the need for children, then they can actually focus on learning. So many students experience adult problems in their childhood. And so it's important to have adults who care and resources who are able to ease the burden of some of those needs. Those needs include things from regular dental checkups, vision checkups, checking them up for colds and giving immunization shots when you're not able to go to a clinic or to a physician. But they also go towards more touchy items of like counseling and helping to give advice with domestic violence situations or the changing of your body and going through puberty and things of that nature. So having conversations about what's normal, what's natural, and to give more self-esteem, more awareness, and a sense of community and support. There was a great benefit of being in a room with over 75 individuals in 5 different school districts who have community health centers in their schools. One of the things that I've noticed is the support for staff with the health clinics in schools that other school districts are doing. Our clinic actually focuses solely on students and we do not serve staff, but it was something that was unique to see districts using. And so the larger question has to occur as to how we support our children and then our staff so that overall achievement and attendance and health increases, because all of us are dedicated towards the wellness of our students, staff, and entire school community. So it was great to share tips, ideas, and to see great collaborations between the healthcare providers and the school systems.
For me personally, it's trying to find a solution for all of our kids that will address their entire needs. I think a lot of time their physical needs and mental health needs get in the way of their academic success. And if we could eliminate some of those challenges and hurdles, we could help with that. Our school district is very rural and we're 30 to 45 minutes from any kind of basic services at all or any kind of town. And so it's hard, everybody has to take a day off school or a day off work, and a lot of folks don't have the transportation that they need to get back and forth. And so just trying to find some solutions that we can provide as our school district to meet those needs. Well, I think it would help with attendance, but I think it would also help, especially with mental health needs in a rural area in southern Missouri. I don't know that it's always a real popular thing to go get your mental health needs addressed, and I think if we could get that set up in a school situation where folks could see that it's okay just to go talk to somebody and get help. Typically families are okay with kids seeing their school counselors, but school counselors can only do so much, and they need a lot of the kids and families additional support that a school counselor is not set up to provide. I think that all school districts struggle with trying to make sure that the kids' basic levels of needs are met. Their food, medical needs, mental and emotional needs, safety and security needs, and for many, many kids, that's what is in the way of being successful academically. If we can alleviate those needs, then we're going to be able to focus on academics. We'd love to be able just to think every child will come in and be rip-roaring and ready to learn, but that's not always the case, and we need to help take care of some of those other bigger challenges so they can focus on school. Yeah, I think it's really great to have everyone come together and find out that there are as many different models as our school districts in the state, and that the solutions are vast, everything from working with government agencies to working with theoretically non-for-profit hospitals to be able to find those solutions. I also think it's really powerful to have department heads and decision level folks at the different state organizations and entities, Department of Mental Health and Family Services, having everyone come together and hear the same information is great. I think it would be awesome if we could have some of the decision makers at those for insurance companies and major hospitals and some of the other big players at the table all to sit down, because if you get enough decision makers in the room, we all want to do the same thing. We just need a little bit of time together to hear one another and try to figure out one another's language so that we can get our problems solved.
So this meeting was very interesting for me when I first saw the topic because after being a school nurse for 20 plus years, I find the challenge of school health services becoming bigger and bigger each year. The fact that accessibility to health care becomes more difficult and the need for health services for our students increases, especially with mental health services, has increased tremendously over that time. This meeting brought together several state agencies along with school districts just to talk about what the needs are, what the possibilities are, what are the challenges and the barriers that we can all sit and talk about that and discuss that part of it. But then to hear some of the success stories of school-based health clinics or school-linked health centers was very beneficial to me. I had the attitude that this was probably not something our district could do, but after hearing the success stories today, I realized it's a very doable thing. It's something that our students need, the families in our community could benefit from, along with our school district could benefit. My goal is to reduce the time that student is not in their seat in the classroom, and a school-based health center is something that can help meet that challenge and increase the time for all kids to be in their seats during the learning time, during the school day. So as a school nurse over the past few years, whether it was on a national level at the National Association of School Nurses or on a state level or local level, I've heard many discussions about school-based health centers. Sitting on the board for the National Association of School Nurses, this has been a topic that has been discussed at a board level also, at a national level. And sometimes you hear school nurses say they don't think it's a good idea or they feel threatened by a school-based health center. Other nurses that may support it and think it's a good thing, but it seems like school nurses are just an important part of connecting the healthcare services in a community with the students and families in your community. So it seems like I think school nurses are that's just continuing their role of connecting the students so that a school-based health center is not threatening to a school nurse, but just makes her job easier and helps the access to care become a better part of that process.